Hi there, and welcome to Learn Hematology. This time, we focus on the spleen. The spleen is a small organ located in the upper left side of the abdomen. The embryonic spleen appears in the first trimester of pregnancy, eventually weighing about 135 grams in an adult, with a blood flow that is approximately 5% of the cardiac output. It broadly consists of white pulp, a marginal zone, and red pulp. It removes old and abnormal cells from the blood, eliminates inclusion bodies in red blood cells in a process called pitting, and removes microorganisms, foreign particles, and tumor cells from the blood. Hypersplenism is defined as blood cytopenias or low blood counts, usually neutrophils and platelets, in the setting of splenomegaly, or an enlarged spleen taken to be more than 13 centimeters. In contrast, hyposplenism refers to reduced splenic function either from disease or from the absence of splenic tissue. The most common causes of splenomegaly are congestion, for example related to a heart failure, liver cirrhosis, or Budd-Chiari syndrome, where a thrombus might form in the inferior vena cava or hepatic vein. Immunologic, for instance, related to infectious mononucleosis, splenic abscesses, malaria, or systemic lupus erythematosus. Related to hemolysis, or the destruction of red blood cells, for instance in thalassemia major and sickle cell disease. Finally, infiltration from hematomas, cysts, CML, lymphoma, and neuroblastoma. Besides treating the underlying cause, the enlarged spleen can be removed via surgery, for instance a splenectomy, or irradiated. Hyposplenism, on the other hand, is often related to autoimmune diseases such as IBD, celiac disease, and rheumatoid arthritis, sometimes occurs in graft versus host disease in transplanted patients, or results after a splenectomy. Hyposplenic patients require vaccinations against encapsulated organisms, such as Haemophilus influenza, Neisseria meningitis, and Streptococcus pneumonia. This helps reduce the risk of overwhelming sepsis that can occur from impaired splenic macrophage function. Although the spleen has intrigued doctors and philosophers since olden times, now you know what the spleen does and what happens when it doesn't function properly. See you in the next video.